Welcome to my world. Another day, another time, another period, another season for knowledge acquisition. Knowledge is power, health is wealth. Today's topic is titled Menopause and Erectile Dysfunction Review. The last topic was so exciting that there are certain feedback I got, and that warranted this review. Some people regarded erectile dysfunction as a disease. Yes, I agree with anybody. Even menopause is disease because the definition of disease, even taking it from that word, disease, it means you are no longer at ease. So anybody that is no longer at ease with a normal situation at old age obviously will seek how to overcome such a problem. So it is absolutely right for anybody to regard this as disease if he feels that is not okay with the situation. But if you want to think in terms of religious and the priests, I doubt if they can feel no longer at ease with any situation that has to do with menopause or anthropos, or what you may want to call women menopause, because by nature or by their callings they are not expected to be troubled by such situations. Having said that, let us now look at what we can understand more, what we can do where we feel that our situation is not acceptable. Let us for the moment look at certain issues that shows a strong similarity between menopause and andropause, or better called erectile dysfunction. To understand the similarity between menopause and erectile dysfunction, we must first of all understand that menopause could be called ovarian dysfunction, and then it becomes clearer. Ovarian dysfunction and erectile dysfunction similarity. Menopause could be defined as the permanent cessation of menses. It is not necessarily a negative experience for every woman. Erectile dysfunction, it is the permanent inability to achieve or maintain penile erection sufficient for satisfactory sexual performance. You must understand that it has grade. It is not automatic that the person becomes permanently impotent. Continue with the similarity. One, we've defined that is ovarian dysfunction versus erectile dysfunction. Two, ovarian dysfunction starts by irregular menstruation because the estrogen that acts on the follicle to cause ovulation, and progesterone that acts on the corpus luteum to prepare the lining of the endometrium for the baby are now inadequate due to old age. It may not necessarily be old age, true, but it may be younger people, but that is the reason. And usually, if it's any other reason, then that calls for treatment. The erectile dysfunction, on the other hand, starts because the testosterone that strengthens the muscle, exercises the brain, creates that sex drive, and helps erectile function is in low supply due to old age. The same situation could be before old age and may need studies to really correct the anomaly. The third similarity is how man has exploited the knowledge acquired. Progestin, that is more powerful than the progesterone stimulated by luteinizing hormone, could be given to prevent menstruation as birth control pill, and that is where the knowledge comes from. And also, xenoestrogen could be given to help in stimulating the follicle instead of the follicle stimulating hormone from the pituitary, thereby reducing the reactions seen in menopausal women. These are areas application of knowledge acquired to for treatment and or probably extending the puberty of women. Testosterone also could be given exogenously to energize, activate the libido that was lost or decreased. Menopause has 3 grades. This is another area of similarity, that you can grade menopause into perimenopause, where it's irregular flashes, dry vaginal menopause itself, that is the true experience of menopause, and postmenopausal, when it states the blood refuses to come out, there is no menses for 12 months. On the other hand, erectile dysfunction has 5 international index of erectile function. It subjectively scores over 25 marks, taking cognizance of the erectile function, orgasmic function, sexual desire, intercourse satisfaction, and overall satisfaction. The questionnaire is scored from severe, mild, moderate to normal. Normal means that there is no erectile dysfunction. Now, for younger people who should be worried with menopause symptoms or erectile dysfunction symptoms, the scoring helps. It helps a lot. And grading is very necessary in monitoring treatment progress. And that from here, it leads us to confirmatory laboratory diagnosis. We are now set for the laboratory examination to get the normal values, which I shall present now. The normal value you are seeing in this page here, and you can see that the older you become, the lower the testosterone. So that is very instructive. For menopause, you can see the normal level for it is taken as 30 to 40 picogram per mil, and you can test for up to 3 or 5 hormones: FSH, LH, progesterone, estrogen, testosterone. All their normal values are there, but once the values are below normal, you can suspect the
Yes, treatment is with the clinician. You really have to get the clinician to do that for you, but you can understand what you'll be looking out for to be treated for. Finally, I like to say that depending on your age, the problems highlighted here are normal if it's experienced at old age. But where you are experiencing it very early, then the precautionary measures one will take are listed. One, the laboratory also plays a very important role to let you know whether it is correctable or not with hormonal treatment, hormonal therapy. Some people will even go for correction by transplantation when you have organ transplant or cell transplant or whatever graft transplant that is needed to be done in order to bring about that youthful exuberance, youthful experiences that we always like. There's nobody that don't want to be young again, especially with the pains of old age. So if you like my presentation, my channel, just press the like button, subscribe, and be sure that more quality production will come your way.